Achieving universal health coverage and quality health services for all is part of the Kenya government's Big Four agenda. To realize this goal, health leaders and managers require reliable, quality and timely information to plan and make decisions regarding health interventions. In 2016, the US government, through USAID, funded the Health Informatics Governance and Data Analytics Project, HIGDA. The project, that was led by Palladium Development and Consultancy with PATH and JKUAT as sub-grantees, aimed at strengthening health information systems, monitoring and evaluation at national and county levels.
And Palladium is one of the leaders in the creation of digital health products. We see that policy and governance as the foundational enabler for strategic information within our public sectors.
The main purpose of the project is to strengthen leadership and management capacity for HIS and M&E, both at the national and county level. At the national level, HIGDA has worked with the unit that's responsible for HIS, that is now referred to as the Directorate of Health Policy, Research and M&E. We've also worked with the HIV program, being NAC and NASCOP, malaria, National Malaria Control Program, reproductive health and nutrition programs. We were set out to work in 20 counties as well.
To foster the country's health information system, HIGDA worked with the Kenya School of Government to design a leadership and governance training program that equips health managers with the knowledge and skills required to effectively coordinate and manage HIS activities.
We were 30 of us from different departments in the ministry, including the programs that is malaria, HIV and TB, then not to mention from within the national government level. There were quite a number of areas which we covered in data use, which has really been a challenge in the country, because we all know that whenever you're making a decision, you have to have the right data, the right, accurate, correct data backing you up to be able to make the correct decisions which are going to have a positive impact in the lives of Kenyans.
HIGDA has also helped us support our M&E program, which we were not doing well at all. Now at least we have appointed somebody who is in charge of M&E program.
HIGDA came under the component of the health information and health system strengthening. One, by providing technical support, which was really required. Two, by providing financial support during the meetings of this. And three, providing a platform whereby everyone can access all this information from different subcommittees and inform the ministry on the milestone towards achieving universal healthcare coverage.
By disseminating health information policies and supporting counties to track the implementation in a structured manner, HIGDA addressed one of the key priorities in health systems strengthening. The trained county health managers have also produced useful information products to guide decision-making, resource allocation and mobilization, as well as advocacy.
We were trained on how to utilize GIS for informed decision-making. And this has been transformational. It brings the third dimension of looking at public health problems in the context of space. As an example, we were able to utilize GIS or a GIS platform to find clients who were testing HIV positive but were not linking to care.
Through interactions with HIGDA, we've seen a massive transformation in the program. Why? Because they created a link which was previously missing with the HIS unit. The reporting has improved to above 94% currently, where it used to be below 90% in the past.
There was one ward where the fourth ANC was low, it was red. And that MCA was really concerned. It made us go to the ground. The women said, we want to go to the facility, but the roads are so bad. That MCA was able to make efforts for the road to be made.
The rising confidence and innovation ecosystems have spurred inter-county learning, leading to diffusion of progressive ideas from one county to the next. Thanks to HIGDA's partnership with the Council of Governors, the success stories from counties have now been documented and disseminated through the Maarifa portal.
Health is a devolved function, so sharing information on the performance of counties on health itself is responsibility for the Council of Governors. Specifically, HIGDA has supported the Council in improving health data itself, data on a number of indicators, because HIGDA seconded staff to the Council of Governors. So the health area of data analytics has been very important. HIGDA has also supported us to promote peer-to-peer learning among counties.
I think that has been a very important platform for us as a county, because we are able to learn from other counties. Like we learned much from what Kisumu was doing in the e-resource component, whereby they developed an e-resource center within our website, and they were able to, of course, put in their key documents, their CIDP, their AWPs, and any other documents that will aid in M&E.
The one thing we really got was the way Homa Bay was coordinating their stakeholders. They even had a website. They had geolocations of their offices. We liked that.
As Mombasa County, we already have a documentary for the first time. We have 2 documentaries on the Maarifa platform, one for the key population, the other one is for use of SMS for referral. So we really thank HIGDA for that.
One of the biggest success stories for HIGDA was the establishment of the Digital Health Applied Research Center at the Jomo Kenyatta University of Agriculture and Technology. The center has provided a platform for collaboration, training, and software testing, and it continues to positively impact lives of students and health officers across the country.
We've been able, to sensitize our student population on the usefulness of data analytics, visualization techniques, in as far as advocacy is concerned. And we believe that as our students go out to the field, they are not required to be retrained. They already have the skills and they are ready for the market as it is now. As far as the health workers are concerned, we've been able to generate information products that have been used effectively for resource allocation, resource distribution, and also for predictive analysis. We've also been able to support counties to move from just descriptive analytics to predictive analytics that you can use, especially the maps, to determine or predict disease outcomes.
The knowledge will really help us, especially after graduation, because we'll be able to store data electronically. We'll also be able to retrieve data faster.
We also came across GIS, whereby we learned how to map data, how to present data in a geographic format.
The center has been a key driver of orderly and structured automation of health systems by supporting counties to implement the Kenya Health Enterprise Architecture, as well as improve interoperability.
Well, the project was able to demystify governance in the health sector. By this I mean that we had come up with several governance tools like e-health policy. We also come up with the Kenya Health Enterprise Architecture. We also come up with interoperability standards for Kenya. We have also come up with health standards and guidance for Kenya. And all those documents were meant to facilitate the improvement of care at the county level. So what happened with this project is that when they came on board, we were able now to sensitize the counties on how they can be able to institutionalize the utilization of this document.
In Kakamega County, for example, the referral hospital has achieved interoperability between 2 systems currently in use in the hospital, cutting turnaround time by up to 50%.
We had several systems, but they were like in silos, debugging on their own without any form of information exchange. And they were not complying and conforming to the standards that have been stipulated in the Kenya Health Enterprise Architecture.
We have more than 5 systems in the facility. Through the blessing of HIGDA, they have come and helped the facility to install an interoperability layer. Turnaround time of viral load results, which could take longer, has been reduced to half.
Other products that HIGDA is proud of include the HIV Situation Room, the ACT and UHC dashboards, all set to revolutionize the use of automated data for improved health outcomes.
We were able to develop the UHC dashboard at policy level, is able to inform at a glance the CS, the PS. This is the level of health, this is where we want to go. So we're able to give data on service delivery, health statistics. We're able to give you about commodities, how well are they moving from the KEMSA to the facility level. We're also giving you data about HR.
The initial results from the HIGDA project have given hope and greater promise that Kenya's effort towards evidence-based health planning and service delivery is well on course.
I'll remember HIGDA as an organization that came and created a very, very big impact in terms of how to use data for decision making.
HIGDA, providing real-time health information for effective decision making and effective resource allocation.